I would like to share with you about the hand therapy following an injection from mummy's thumb today. So there are two invasive procedures for mummy's thumb, also known as the Quervain Tenosynovitis. They are either injections with either steroid injection or PRP injection, or the mummy's thumb surgical release. So it's once a step up. So normally when someone has mummy's thumb, depending on severity, if it's mild, moderate, uh, typically hand therapy and a dose of splinting for 6 to 8 weeks will usually help patients to recover without injections or surgery. In some cases where the cases is a bit where it's too painful or it's a little bit advanced, patient don't want to wait or prefer to heal much faster, patient then can choose between doing hand therapy plus injection or hand therapy plus surgery and vice versa, right? So I share a video about hand therapy after mummy's thumb release surgery. So this video is all about mummy's thumb injection and hand therapy. So hand for injections for mummy's thumb, there's two types of injection as I mentioned just now. You can either opt for the steroid injection, which is the one of them, and the other one which is PRP, which is plasma rich protein injection. Data and evidence shows that steroid jabs work, but because it's been researched so much more over the last few decades, right? Whereas PRP, plasma-rich protein, it's actually newer. So some doctors may not be very keen to do PRP for the wrist and small joints. PRP is more known for larger structures such as the tendons or ligaments in the shoulder, in the hip, bigger stuff, right? So you can see in the image over here, right? So let's say you're going to do an injection, be it PRP or steroid. What's going to happen is that they're going to inject the solution right into your wrist, where the tenosynovitis happens. The tendon and synovial sheath is painful. So they will spray a cold spray to make sure that there's a bit of anesthesia there, and then they rest your hand slightly this way, and then they inject it usually this way or this way, whichever is comfortable. No matter what, it will be tender and painful, right? Um, Once they inject in already, what you can expect swelling for next 1 to 7 days. And then patients will say most of patients will feel some sort of relief immediately, between 30 to 80% relief, because there is a numbing structure inside there, so it brings the pain down immediately, right? Usually after injection, we will not do therapy for a while. We let the inflammation and the swelling goes down. Sometimes what doctors will do is that after doing an injection, or even when they do a mummy's thumb surgical release, they will say, Nigel, or get one of your hand therapists to do resting hand splint so that we do not aggravate the tendon, right? So then they'll send you home for about 2 weeks. And then at phase one, if the doctor says that, hey, you can start gentle hand therapy, what we do is that we manage the swelling. You can see the phase one over there. Yeah, we manage the swelling. We will maintain the range of motion of your wrist as well as do the tendon glide. I will do another video for you guys later. So the simple range of motion for the wrist, there are 6 motions, right? So typically it's a front flexion, extension, rotate up, rotate down, and deviations. This way, side to side. So at phase one, we just do very gentle stuff. We don't have to do too much. Okay, once the swelling has gone down, the inflammation has gone down from the injection, patients either feel really good or patients feel like, no difference. Most time they feel good or feel less pain. Then we can proceed to phase two. Phase two usually starts around week 3. So at this point, we will start doing more range of motion exercises and more tendon gliding. It's just more complex. So instead of just front and back and then turn up, turn down, and side to side, we start saying, hey, okay, let's make it a bit more difficult. We put your thumb down and then you glide all the way this way for max tendon glide. If this is easy, you make it more difficult. You can put your thumb down this way, fingers across, they stretch this way, stretch. So getting more gliding for max range of motion, max tendon gliding for your wrist and your tendon without pain, okay? I don't like sharp pain. So a bit of aching, a bit of gliding, kind of like a moving pain after the injection is fine. Sharp pain is a no-go. And then after a few weeks after that, we're looking about week 6 to week 8 onwards, we can start with strengthening. So this means that we will get you to do the same motion as in phase 1 and phase 2, ideally phase 2, but with resistance. So I may use a therapy band, I may use dumbbells and get you to exercise this way. Basically, is to load your wrist, load your wrist joint, load your tendons, right? With resistance. So as it gets stronger and stronger, there'll be less pain. Also, of course, once you strengthen up not only your wrist joint, but you strengthen up the muscles of the forearm, the flexors, the extensors of the hand, it will also offload the amount of load that's being pushed through the wrist. So at least it defrays off of all the pain going to the wrist, of course. So that's generally what we do for hand therapy for bump stem injection. Of course, in phase 2, phase 3, you will have other things that we will include in, such as we have introduced heat modality. For example, paraffin wax bath. We introduced in the heat pack. We also introducing the ultrasound machine to accelerate soft tissue healing. Ultrasound machine is great for tendon healing, ligament healing, muscle healing, things like that. And other things that we can help you accelerate your healing as well. So that's all for this video. If you like this video, comment down below, like it, share it with your friends. Let me know if you want me to add anything else. Okay? Take care, guys. See you. Bye.